Hello, I'm Christina Adeleke, Senior Policy Manager of Health Equity and Public Affairs at AIDS United, and I am honored to be joined today by Jesse Milan Jr., Esquire, the outgoing President and CEO of AIDS United. Today's conversation is held in recognition of HIV Long-Term Survivors Awareness Day, a moment to center the voices, experiences, and resilience of those who have lived through the decades-long fight against HIV. Let's get into it, Jesse. Thank you for being here and for all that you continue to do for this movement. Our first question. Many long-term survivors are now in their 30s, 40s, and older, having lived with HIV for decades. While advancements in HIV treatment have greatly expanded and extended the lifespan of people living with HIV, some still experience challenges related to long-term treatment and care. What are some of the challenges you've experienced as a Black gay man living with HIV for over 4 decades, and how have you navigated them?
Oh, well, that's a really interesting question, Christina. You're right. There are people who are long-term survivors who are in their 30s and 40s and 50s, but I also know people who are in their 60s, their 70s, and I have one friend who's turning 80 this month. Who's been living
That's
with
exciting.
HIV. Yes, right. So long-term survivors covers quite a number of people, including people who were born with HIV, the dandelions. But as a Black gay man living with HIV for a long time, I had an opportunity to have literally one of the best HIV doctors in the country become my doctor. In fact, that doctor at Johns Hopkins, Dr. John Bartlett, his practice was so important that I had to be recommended by someone to have him take me on as a personal patient. And when I was in my early 50s, in my very early 50s, because I'm about to turn 69 this summer.
No.
69 this summer, right?
You look good for
So,
69, Jesse.
And I've been living with HIV since 1982. So when I had an appointment with Dr. Bartlett when I was in my 50s, because I was concerned as a Black man about all of my health. And so I said to him, while the two of us were in the examination room, I said to him, Dr. Bartlett, I'm a Black gay man of a certain age. Shouldn't we be thinking about something besides just my HIV?
Right.
And do you know what his response was? Nobody had ever challenged him about their broader health care. And because he knew who I was, he thought, oh my gosh, you're right. And so what he did was he recommended that I see someone who had a broader perspective, who also had a specialty in HIV, but could talk about all the other issues. So I accepted his recommendation, and I moved to that other doctor, who is a specialist in infectious diseases, but also has a bigger perspective for me as a Black gay man. And that doctor has been looking at my broader health in addition to just my HIV. But there are many challenges from being on these HIV treatments for a very long time, and some of those challenges are around taking the medications and making sure that you flush those medications out of your body by drinking plenty of fluids. So we always hear that that's important, because if you don't, those medications might develop a crystal in your kidneys, which is what I had twice. Twice I had kidney stones, and one of those episodes was right at the AIDS United office, and I had to have our vice president take me to the emergency room because I was passing a kidney stone.
That's painful.
And when the kidney specialist got in to find out what was the problem, the first time it happened, he discovered as soon as he touched the stone, it turned out to not be a stone. It turned out to be crystals from my HIV meds. And so I learned that it is really important to be careful to make sure that as a Black gay man that I have all of my health being looked at, but also to make sure that I'm doing what I should do, not just taking the medications, but making sure I'm taking the medications correctly and I'm drinking enough fluids to keep my body to keep those medications flushing through my body and working.
Wow, that's insane. I did not know about that at all.
It was a horrible day to have a kidney stone pass in the middle of the office.
Oh my gosh, I know, it's like too
And
many.
have my COO at Age United take me to the emergency room.
It's a different day at the office for sure.
But it is important to be cognizant about what you're doing and to make sure that
Right.
all of your health is being taken care of.
Thank you for sharing that. So you mentioned some physical challenges that could come if you're not, careful with your medications, you're not drinking enough water. But, even with the decades of progress, many long-term survivors deal with additional issues, such as ongoing mental and emotional health challenges, isolation, and stigma related to aging with HIV. Where have you found your source of joy, love, community, and peace over the years?
Well, I'm very lucky. After my late partner died in 1985 of AIDS, I took a little time to deal with that. I was only 29 when my late partner died in 1985, and that was a big growing up experience.
Right.
I mean, I had to navigate his illness and death in our own home. Then I had to navigate funerals and memorial services, and then suddenly I'm 29 turning 30 and I'm an AIDS widow. What does that mean?
Right.
And I'm not the only one. We've had over 750,000 people die of AIDS in the United States. There are a lot of people who still grieve the loss of people from the 80s and the 90s and even the 2000s. And there are, of course, still people dying today. So that was a big thing. And so it took me a while to transition through all that grief to be ready for the next thing. And I found that next thing in an AIDS organization in Philadelphia that I was on the board of, and found my husband. And he and I have been together now for 36 years.
Wow.
And we've been married, and we were officially married on our 20th anniversary, soon to be 17 years ago. So I've been very lucky, and of course, we're a discordant couple, and so one of us is positive and one of us is negative, but I had to find someone who understood that.
Right.
And so many people who are particularly long-term survivors who have those memories of people being sick and dying, that still is in the back of our memory. That is in the back of our mind for ourselves. And so many, many people were not able to find the kind of marital love that I have with my husband, with Bill, but it's not impossible. And I think that kind of intimacy that everyone wants for their life is a fear that you might not find that if you're a person living with HIV. When AIDS United did an HIV and aging town hall meetings across the country, we heard these stories from men. And one of them said, I know more people who are dead than alive. Will I ever find love again, was what someone else said. And so that kind of isolation or fear of isolation really is very prominent among many long-term survivors. But it's not impossible. And that can be very depressing to know that as you're aging, you may be facing those twilight years alone. And I know that really does mess with people's mental health, thinking forward. And so I certainly understand that. But it's not impossible. So my friend who's turning 80 next month, who has been living with HIV since the mid-1980s, he did find love. And he got married to his current husband when he was 66 years old.
Ah, we love to
So
see it.
it is possible, but
Wow.
I do understand that too many people are still living in the world of, it's too late for me, it'll never happen for me. So finding joy for me has been, of course, I have my husband, but I also have a spiritual community. And
That's important.
For people, particularly of a certain age, for whom spirituality has been a foundation for them. If you can continue to find a spiritual community, that's important. And then whatever your social community is, so long as you're engaged in it. And I think our own families are important too. My whole family knows my HIV story. It's hard to be authentic in your own family if you can't be authentic about everything you're suffering, especially for the black family. We talk about black family members with diabetes, with heart disease, with all kinds of issues. If you can't have that kind of conversation or be open about your HIV status, you're not even presenting your entire whole self to your own family. So I've been able to have that with my family. I still have a dear social network of friends who, I've got a group of friends who are coming that we do New Year's Eve with every year for the last 25 years. And of course, my husband and my spiritual community, those bring me joy.
Wow, so you're overflowing with joy. You've got a lot of different social networks and a lot of support in your life. And that does make things easier, for sure, for sure. All right, I kind of want to circle back to something you touched on earlier, which is a newer issue now with people aging with HIV. They're now having to deal with comorbidities associated with aging. So I know that advocacy and research efforts continue to evolve to address the needs of long-term HIV survivors, from managing comorbidities to improving their overall quality of life. How do you see advocacy playing a role in supporting these evolving needs?
Well, as with my doctor several years ago when I said, look, I'm a black gay man, what are the other issues we should be looking at? You do have to be a personal advocate for yourself in healthcare. What is this about? Why am I feeling this? Should I be concerned about what my father had or what my great uncle had?
Right.
All of those are things that we should be advocating for ourselves. And if we can't do it ourselves, take someone with you who can advocate for you. It's okay to bring someone to the doctor's office with you, who you say to the doctor is empowered to hear and to help.
Right.
That's okay. But the advocacy that we need on a bigger scale is important. I think in these political times, knowing what is happening politically around HIV funding for prevention, for treatment, care, and research, all of those affect us because prevention knows we want no one else to have this. For treatment, care, and research, we have all of those things that need to be done for us, and we need to be involved in it. So not only do we want to be advocates for being part of research, but we want to be advocates for the federal and state support for HIV/AIDS prevention, treatment, care, and research. And our advocacy can help empower us to make sure that we're not feeling like we're being the victim of political decisions.
Right.
Instead, we're working to make that the political decisions are being done in our favor for us because we say what we need. Meaningful involvement of people living with HIV is true for all aspects of HIV, including meaningful involvement in the political and the policy process.
Yes, and I definitely anticipate that space when it comes to just HIV and aging continuing to evolve and grow, hopefully, with our advocacy. According to the CDC, 1 in 2 black men will have sex with men or are projected to be diagnosed with HIV in their lifetime if current infection rates continue. How do you think the current social, political, and sexual climate might influence that trajectory?
Well, the current political environment where DEI is being dissed and being dismantled is not helpful, but it is one that could very well lead to a greater number of HIV infections. Because if we're not able to address health disparities and work to achieve greater health equity based on racial demographics, based on regional demographics like the South, if we're not able, or even gender identity and gender and sexual orientation, if we're not able to address all of those areas where disparities exist, then we cannot achieve greater health and wellness for the entire nation. And so it is important that we focus on each demographic and what is necessary to help them stay healthy. And that's true whether it's for our racial identity, our sexual orientation, or our gender identity, or even where we live. And those identities must be addressed, because otherwise we will have a nation full of disparities that will continue and will only get worse. There are projections that if the political environment is successful in reducing support for HIV research and HIV prevention and care, we could have another 100,000 new HIV transmissions within the next 5 years, and over 10,000 more HIV-related deaths. And so we know that if there are more infections, the larger proportion of them are most likely to be people who are disenfranchised, people who are already living on the margins, and that is too often people who are people of color and people who are in the LGBT community. So we have to work to address the political environment to make sure that the progress that we've made does not go backwards. And that progress has been because we've been focusing on the subgroups within the HIV community and those at risk for HIV community to get the prevention, the treatment, the care that they need. And we don't have enough people on PrEP, and we know that we do not have enough people who are virally suppressed who have HIV. And if we don't focus on getting those to the populations that need them the most, we will slide backwards and have more transmissions and even more deaths.
Long-term survivors of HIV and AIDS have endured decades of trauma, illness, and social isolation while facing stigma and marginalization, like we've talked about. Over 4 decades of treatment, activism, and advocacy, how have you seen the world and the HIV conversation change or remain the same? And in what ways has AIDS United contributed to the progress in the movement, especially for Black gay men?
Well, I think over the decades of the HIV epidemic, we've seen the voices of people of color who are either vulnerable to HIV or have HIV, their voices being elevated. And those voices have elevated in a tremendous way by particularly using the concept of MIPA, of meaningful involvement, basically saying no decision should be made where we are not at the table to help make those decisions. And that's true in organizations, that's true in government, that's true in research. And so I've seen that change over the years. And I am not in any way suggesting that the early years where white gay men particularly were on the forefront of helping to build infrastructures and communities. Without those early years and the work that they did, we would not have what we have today. But across the decades and over the years, more voices have been involved. ACT UP was a very rainbow coalition, you know, with the Ryan White program, even our advocacy for the Black diaspora around HIV/AIDS, right? PEPFAR is creating the possibility of now 26 million people's lives have been saved, and those have been primarily people of color all across the globe. So we've raised the voices of people and the role that people of color living with and vulnerable to HIV play. When I became the CEO at AIDS United, I got the sense that my Black peers who were leaders in the movement really wanted me to have this job. And I was so grateful when one of them said to me, "Jesse, all of us want you to have this job." And I was so grateful because AIDS United is and it continues to be a very important organization. But to know that I've had that behind me, and I know that Carl will have that behind him as well as he moves into the CEO role, that is huge. And so whether you are playing a role on a board or in a community-based organization, whether you're on a staff or on a board, even if you're a client, your voice is important. And that voice has been raised and raised and raised, and we cannot let it be silent in this political environment.
Amen. I agree. As we've been talking about, while people with HIV are living longer, many still face unique physical, mental, and social challenges as they age. As someone who has lived and thrived with HIV for over 40 years, what concerns do you have for Black gay men aging with HIV today, and what wisdom would you offer them?
I think about the important role that Medicaid plays and the important role that Medicaid is not allowed to play in too many places, particularly in the South, where a significant proportion of Black gay men who are either living with HIV or vulnerable to HIV reside. And not having access to insurance is an impediment to long-term lifelong health and wellness. And so I'm very concerned about the fact that Medicaid currently has not been expanded in terms of eligibility for Medicaid in too many southern states. And I'm concerned about what the current political environment is thinking of doing to Medicaid that might restrict who can even be on it in states where it currently exists. And so it exists in terms of expanding eligibility through the Affordable Care Act. So I'm very concerned about that. And I'm concerned that HIV research may be halted or significantly reduced about all of the aspects, because HIV research is the research that helped us find the vaccine for COVID-19, right? We still don't have a vaccine for HIV.
Not yet.
And not yet, that's right. And so we cannot stop this research, and it'll be so wonderful. We could just give you a shot and say, you're never gonna have HIV.
Right.
So I am concerned that we continue to, in this political environment, we're gonna need to continue to keep our advocacy moving very strongly for making sure people have access to insurance, access to prevention, treatment, and care, and that federal funding is not reduced. Because if it is people of color who I think will particularly suffer.
That is so true, so true. As you referred to earlier, you will be retiring from your role as president and CEO of AIDS United. As you reflect on your leadership, what do you want people to understand about your journey, and what message do you have for people in the workforce who are also living with HIV and striving to reach beyond the glass ceiling?
Well, the second part first. For people who are in the workforce, these are hard times and these are hard jobs. So I want to say to them who are in the workforce today for HIV/AIDS, thank you. Thank you for what you're doing. Thank you for what you've done. And thank you for staying the course in these very difficult times. Our community needs you, and I hope that you know how grateful we are that you are willing to dedicate your professional life to this work. That is really important. And I would say what I hope people know about my journey is that I feel very blessed in many ways to have had opportunities unfold before me that allowed me to do greater service to the HIV community and greater service to the world. I think people look for excellence, and they look for people who are delivering excellence. And if you're delivering excellence, you will find that things open up for you without you having to ask. Because people will look to you and say, that person, Christina, you're doing excellent work. Would you do this? Would you consider that? Would you work on this? And those are wonderful statements of how much someone has already vetted you because you're doing excellent work. Excellence is important. And I've just been so lucky that I didn't have to look for things. Too often they came to me, including this position at AIDS United. I literally answered the phone, and it was a search firm who said, we've just been hired to find the interim CEO for AIDS United. And Jesse, you're the first person we thought of. Will you do it?
Wow.
I consider that a holy moment in my life because it opened a new opportunity, but it's not one that I went looking for. but boy, am I grateful that it came. And I'm so grateful for all the opportunity that I've had over these last 9 years to serve this community, to work with people like you and the team at AIDS United. We've given away, during my time at AIDS United, $73 million.
Wow, that's big money.
And the Public Policy Council has grown to over 60 organizations. And we've done capacity building at national and state levels. I'm so proud of that work. And for me, this is the capstone of my career. And I will be forever grateful for the opportunity to serve AIDS United.
Thank you, Jesse. We're so proud of you, and we're so grateful for all of your contributions. And we can't wait for your future. It's just the start. Thank you.
Thank you, Christina.
Of course.
Thank you.